Good afternoon and welcome to our session on wellness and professionalism. I am Dr. Amy Kotsenas from the Mayo Clinic in Rochester, Minnesota. I have only one disclosure to share with you today. My institution has developed a well-being index related to burnout. I don't myself benefit from that personally, but my institution does. I will be discussing this topic today with Dr. Puneet Bhargava. Puneet, would you like to introduce yourself?
Yeah, I'm Puneet Bhargava. I'm professor of radiology. My focus is on abdominal imaging. My only disclosure is that I'm editor for an Elsevier journal called Current Problems in Diagnostic Radiology, but I'm not going to discuss anything Elsevier related. I have been very interested in this topic of wellness, professionalism, moral injury, mainly for self-survival. And I've kind of experimented in that space and done a lot of reading. So I look forward to this engaging discussion with Amy, and I hope to learn from her as well. And we will share personal anecdotes and stories and things that have worked for us so that hopefully the listeners get to take away some ideas they might want to implement or at least explore going forward.
So I'll start off and talk a little bit about what burnout is. And we can start with a definition. And I think one of the points that I want to emphasize is that burnout isn't simply stress. Stress is something that in many ways can actually make us better, make us stronger. Burnout is something more. It's really prolonged stress. It's a sense of frustration, and it leads really not just to physical exhaustion, but to emotional exhaustion and a loss of motivation. We're seeing more of it in healthcare, and it really focuses around three dimensions. As I mentioned, emotional exhaustion, feelings of cynicism and detachment from the work that we do, and in healthcare that leads to cynicism and detachment from our patients, and really a low sense of personal accomplishment. It's kind of a downward spiral that just becomes self-perpetuating over time unless we can find a way to break that cycle. At work, we see several causes of burnout. Probably the primary is lack of control or lack of autonomy in what we do. And we see that in healthcare with an increasing number of administrative things that we have to do, rules and regulations that may be imposed on us by our organizations, as well as from entities outside of our organization, either the government or certifying boards. It's unclear job expectations, dysfunctional workplace dynamics, extremes of activity where you may be seeing volumes that are 1.5 to 2 times what you're used to. Lack of social support, I think, is particularly acute in radiology. Since the advent of PACS, we're often working alone in our rooms. We don't have that connection with referring providers that we used to have face-to-face, and we may not have much contact with our own colleagues. Certainly in this era of COVID, many of us may be even working from home. And a lot of this leads to work-life imbalance. And all of these things combined can result in burnout at work. So I think we're going to spend most of our discussion today talking about how we can counteract burnout and really promote wellness. And I look at this from 3 different levels. There are lots of things that we can do as individuals, and in many ways, that's the only thing that we can control. And so we'll spend quite a bit of time talking about that. But I'd also like to touch on what we can do as leaders, because many of you who will be watching this presentation are leaders in your organization. So what can you do to help promote wellness amongst your employees and team members? And then finally, what can we do at the organizational level? What can SIM do or other radiology organizations to promote wellness in our specialty? So, Puneet, I know that this is a topic that is near and dear to your heart, and maybe you could start by sharing some of the things that you have done to promote your own wellness.
Yeah, so I'll tell you this story. It's my own personal story. When I recount it, it gives me satisfaction how far I have come and how far I've been able to protect myself, but also gives me motivation to keep going, because I think the challenges continue to get worse. So I started my career, like I signed on as faculty at the University of Washington in 2009. And my chair at the time called me to welcome me as faculty, and he basically told me that he wanted me to be an excellent teacher, be a astute radiologist, and have phenomenal research. And I walked out of the department, out of his office, and for a couple of days, I was just dazed. I was like, how on earth am I going to do this? How am I going to be a Superman of sorts? Where I will excel at everything I touch. And that was the time where, we'd had our first child, so life at home was pretty busy. And before I even got started, I said, okay, I can't even manage my life. This is too much. Somebody must have figured it out. How do CEOs manage, 5,000 employees scattered in 5 different continents? How do they run their life? And that was a curiosity. And I said, I have the luxury of giving myself a couple of weeks to maybe read some literature on how they do it, and maybe, start afresh. So I started talking to a lot of people who I saw as successful, see what they did right, and started reading some books, which is when I stumbled upon this very business heavy idea of getting things done. And I said, okay, if business people can do it, so can I. So I started establishing systems so that I would get rid of some of the redundancies that we have in our life, not do the same thing repeatedly. And by the time I had some sort of organization around a process, 6 months went by. And my colleagues started saying, well, when are you going to start your career? 6 months have gone by. Before you know, it'll be time for us to put you for promotion. Aren't you concerned? And I felt like I was getting started. And one of my colleagues said, you know what, we're all struggling with this now that you have wasted 6 months on this topic. Why don't you write something that maybe other people will find useful? So I said, all right. So I organized some thoughts, and I thought of 5 people who would join me in this experiment, who I considered good friends, who may not criticize me much if we got rejected with this idea. And we wrote something about it, and I was pretty surprised that they were willing to play along. And we wrote something, and it ended up in JCR and got a lot of attention. But I kept plowing on. Every time there was a challenge, I tried to, like you were talking about, how to do things most efficiently at an individual level. But all along this time, the focus was never to do a million things all at once and look like a superstar. The real goal behind this all was to have a sane life where I was a good dad, a good husband, was able to find enough time to spend with family because I was doing work more efficiently. If you ask my family, they would say he's always working, but it could have been a whole lot worse for my situation if I hadn't really spent the time building some of these skills. So individual skills, like you said, something we can all control. That's what I started with. So that was the start of my interest in this space.
So I will have to admit that I certainly didn't start my career thinking about how I was going to be organized and focused. I kind of dove in and said yes to everything. I've found it very difficult over the years to learn what not to say yes to, what to say no to. How did you decide what were the key things to focus on?
I think this yes versus no is a very interesting idea. And the way I think about it is when you have nothing going for you, when you have to really get your career started, everybody gets a few opportunities, and we have to say yes to the initial ones that come our way. Because if you start saying no right from the get-go, then you might turn off a few people. But there will be very quickly a time where once things start going for you and once you start getting things done, everybody wants to work with people who get stuff done. So you suddenly get asked to do a lot of things, and which is when you get to the heck yes or no situation where Yes should be said to those things where you're jumping up and down, you're really happy because it's a heck yes, you've been waiting for this opportunity to come your way. And pretty much everything else would be a no. I refined that a little bit more recently for my own self. I said, radiology and my life wouldn't be as much fun if I really didn't experience joy along my journey. So lately it's become about any opportunity, if it comes, if it brings more joy, that is something I'd like to pursue. And if there's some things that I've been doing for a long time that no longer brings joy, perhaps it's a time for that opportunity to go to somebody else who could really make use of that. So there's this great book called Essentialism, which is totally worth reading, where it basically talks about only a few things matter. And this was very well described by the Pareto principle, where it's an old kind of, Pareto was this Italian guy who long ago figured out that 80% of our results are driven by 20% of our efforts. So the key is to find out what those 20% of the things in our space are and focus all of our energy on that. Once you figure that out, there's this amazing idea of the one thing. The one thing is also a book where it talks about how you, if you look at phenomenal people, so if it's not, say, Mahatma Gandhi, he was the father of India. If you say, what did Mahatma Gandhi actually do? Well, he got India independence. Well, but if you ask what else, well, there's not that much else. So he basically did the one thing. Now, so don't take this literally. What it means is that all of us have to have a theme, and we can do lots of things in that space, but having lots of things to do really dilutes our effort. So we need to find the few things and hopefully the one thing that matters. And this book is phenomenal. It actually walks you through this process of how to do less, how to find your one thing. And even before you read the book, on the cover inset are 2 footsteps of rabbits. And there's a Chinese proverb at the bottom of those footsteps is, if you chase multiple rabbits, you'll not catch a single one. So, that's the idea. So less is more. And there's things that we can get away from. We have to come into work and we have to make our radiology reports. We have to do a little bit of administrative stuff. We have to keep up with all the work demands. But outside of that, doing few things at an amazing level is what really wellness is all about here.
One of the things that I was reading about when I was preparing for this session was that burnout often tends to happen in those people on the team that are your star performer. And I was thinking about it a bit from the leadership perspective, but I think looking at it from a medical or healthcare perspective, I think we've all been star performers all of our lives. We all through school and in our early careers always strived, I think, to do more and be more. And so I think that it's a difficult lesson for a lot of us to learn. And this idea of the one thing or really the most important thing and focusing on that, I think, is something that may be a bit challenging for folks. Do you have any tips for people who may be, like myself, far down this path of having already said yes to too many things? How do we unwind that?
It's hard to let go. It's hard to let go. I mean, I have a lot of things where I tell myself, I'm going to let go of this. Now it's the right time. And then I end up pursuing that for a couple of months. And then finally I get around to saying no. I think we have to watch what goes on our plate. I think we have to take our time saying yes. The natural instinct is to say yes, because we all want to do more and help. But sometimes these decisions can come at the cost of our wellness. So I think from time to time, we have to reassess of what brings us joy and cut some of the things that don't really bring a lot of value. We have to do a few things at an amazing level. And you know, a good leader is one who actually doesn't overburden their star performer, right? You want to have your best people work on the few difficult problems, because you have to give them the time to fail, right? So when smart people fail at a particular problem, they actually look at that as a failure of the method they were applying. So they're going to try another way. But if you're doing too many things, there's just not enough time to fail. You can try once, and then you just have to give up because there's so many other things to pursue. So I think working backwards is a good way. I think lately I've been doing some reading on life redesign and work-life design. And the idea there is that we work backwards. We think in our heads, like, where do we want to go? And then, and close your eyes and think about, where would I be in 5 years, 10 years, 15 years? And then think about if we're headed in that direction. I'll give you a very interesting anecdote. My brother works for American Airlines, and I was having this conversation with him. He's 10 years younger than me. So it was this big brother talking to a younger brother, where do you see your career go and whatnot? And at some point I used the word that, you want to be headed in the right direction. So he said, you know what? If we take a flight from coast to coast across America, and we're roughly headed in the right direction, do you know what would happen? And I was like, no idea. He's like, for every mile, you'd be off by 80 feet. And then by the time you're 100 miles out, you're about a mile away from your destination. By the time you actually reach the coast, you're in a different city, probably in a different state. So when we, as our careers are pretty long, sort of like long flights, heading in the right direction is maybe not the way to do it. The way to do it is to start heading in the right direction, and then every day, every week, every month, at every opportunity, sort of course correct so that you're headed to where you want to be. I think too many of us, we start out our careers wanting to be something and we finish it at some other place. And I'm always scared at that thought that, I'd be too old to work, closer to retirement, and I would look back and say, well, this is not where I wanted to be, but here I am, and it'll be too late to do the things that matter. So I think I've started to think on paper. I've started to think on, what do I really want to do? And there's this thing where you can have it all, just not everything at once. So there's going to be stages in our lives. Right now we have 2 small kids. You might hear them in the background. And life is different. I mean, I have to roll with them on the carpet in the evening. We play outside. And when we didn't have them, I could do, more writing. But right now, any writing that I want to do has to be late at night or early in the morning or during lunchtime at work. And whatever time I can squeeze in, it's hard. So I think just figuring out what's important in life at a certain stage is really, and this is like, this is like personal finance. There are concepts of like what everybody agrees on, but this journey is very personal. And I think we have to figure out what our value systems are, what do we want, where do we want to be, and try to align them, hopefully line them up as closely as we can.
So I've done a bit of the same thing. I have a few big goals in mind that I want to achieve over the course of my career. And every 6 months or so, will go through my list and say, how close am I to achieving these? What do I still need to do to achieve those? And I look at all of the things that I'm doing in that moment in time. And I look at each one and I say, is it supporting those big goals or is it detracting from them? And I've worked really hard to try to let go of those things that are detracting from the big goals. As I've grown into more leadership roles and expanded my network of people that I'm connected with, both in my home institution and radiology across the country. One of the things that I do is, I don't want to leave people in the lurch by saying I can no longer do this, or I can't do something that they asked me to do. So one of the first questions I've started to ask myself is, who do I know that's really passionate about this? And then I ask them, is this something you would be interested in doing? And then I feel like I can maybe say no to some things, because I'm not going to leave the person that asked in a lurch. I'm going to give them a name of somebody who's really passionate about it. And in the long run, will probably end up doing a better job than I would, because they're bringing that passion.
Yeah, and I do a similar thing. I have this very interesting experiment that I run. So every New Year's Eve, I have a document that I keep on Evernote, and I only look at that document once a year. And I have some life goals and I have annual goals written on that document. And I try to predict my year. What is this next year going to be like? What am I going to get done? And then I look at it in a year's time and then say like, oh my God, I thought the year would be like this, but it's turned out to be totally different. These opportunities that came along the way, I had no idea. These are over and beyond my goals. And then you have to recalibrate your goals sometimes. Sometimes, I think I've had it lucky where, when I started my career, if somebody told me that, you would get one podium talk at RSNA before you retire, I would have been elated. I would be like, this is over and beyond my dreams. And so, I've been lucky to get opportunities. I've been lucky to have mentors and sponsors who have helped me along the way. And so now I'm thinking about, and mission statements are great, right? So I think, companies make mission statements that actually drive all of their business decisions. For example, Southwest Airlines has this very interesting mission statement, which they actually talk about, customer service. And that mission statement really doesn't talk about, having the best gadgets on the seat or, giving the best seat to the highest pair. So they don't have seat numbers, they don't have TVs, and yet they're the most profitable airlines. So I think having a personal mission statement, there's some value to that. I came up with mine, and it goes something like, to leave radiology better than I found it because of me. So the goal would be to do something for my specialty that I can say, well, I started this because, and look, this is helping my other peers. And that's a tall order, writing papers or, doing small leadership roles locally or even in some big meetings doesn't really cut it. So it's hard, but I think once we set some challenging goals, then I think it propels us to think big, and go and do some audacious things.
So to achieve the audacious things, you have to be able to day to day stay on track. Yes. And I'd like to shift the conversation and talk a little bit about some of the things you do, and then I'll share some of the things that I do to, one, keep my goals on track, two, just keep my life sane, and really to maintain both my physical and mental health. So why don't you start with some of the things that you do?
Yeah, so I'd like to think about it in two parts, right? So some people say, you win your day, you win your week, you win your week, you win your month, and whatnot, right? And not every day is created equal. Some days you're more productive than others, and some days you're totally unproductive. Some weeks you can't get anything done. And I embrace that. When I have a day where I'm getting a lot done, I want to prolong this thing that is actually described as the flow state, where you're kind of in this deep work where you're getting tons of stuff done. You want to milk that day for as much as you possibly can, and hopefully prolong that day into weeks. And then, I sometimes have a week or more where I can't get enough done. And I'm like, okay, that's fine. And I know that when I start to get back to my, productive self, that I try to maximize that. That's one way. The other thing that happens is that there's this whole phenomenon of the 5 a.m. club that people talk about. And the idea there is it's actually a book by a famous author called Robin Sharma. It's a highly recommended read. Yeah, there's also a podcast on this by a different person, which is also pretty nice. The idea here is that if we wake up 3 hours before the start of our workday and we focus on a little bit of exercise, a little bit of reflection, and a little bit of reading or watching some videos about motivation, we set our day. And hopefully, when you wake up early, there's no other distraction. If you have kids, they're still in bed, and you get to have a head start to your day. And I practiced that early in my career, where I would show up to work really, really early and try to get 2 to 3 hours of work done, even before you head to the reading room. And that works really, really well. It doesn't come naturally to me because I'm a night owl. So I usually work late into the night. But I think, these days when the days are very long and you're really tired in the reading room, it's hard to wake up late at night. So I'm trying to do what doesn't come naturally to me and try to wake up in the morning. Some days I'm successful, some days I'm not. That's kind of how I do things. I'm curious to see how you do stuff. And the thing that I struggle with the most is how to incorporate fitness and how that helps in productivity.
So a few things that I do, I prioritize fitness, and I think it's an overall prioritization of just health. So there are a few things that I do along those lines. I am fortunate that I'm a morning person, so I tend to get up early, make a healthy breakfast, and my husband and I, we don't have kids, but we do make it a point to sit down and have meals together and have uninterrupted meals, no TV, no devices, really just focusing on each other. We start every day that way at breakfast, and we end every day that way with dinner. And I think that really, that social connection and that closeness, I think it's really important to have that in your life with other individuals. I am not so much a reader first thing in the morning, but I do tend to go and work early, and I have become a believer in the eat a frog kind of mentality, where you find the hardest thing on your to-do list for the day and you do that thing first, because otherwise I will procrastinate the whole day and I won't get it done. And so the best way to make sure that it gets done and doesn't just stay on your to-do list for weeks at a time is to do it right away. I live and die by my calendar. I have lots of meetings related to my administrative work, interspersed between my clinical schedule at work, interspersed with personal things that I do, and meetings related to the radiology organizations I'm involved with. So I schedule everything on my calendar, and that includes working out at the gym. I will put that on my calendar 4 days a week. And, if something comes up during one of those scheduled times that I may need to do, then I need to find another time to move that workout to make sure that I get in adequate exercise every week. And I've started to do that with everything. If I'm asked to review a paper, for example, I've reviewed enough. I know about how many hours it's going to take to review a paper. I look at my calendar. Do I have that many hours in the next 2 weeks to get that done? If I don't have that many hours free, then I have to decline and let them look for somebody else. But I've started to do that with all of the activities in my life, and putting it on the calendar gives me a lot of visibility into where I'm spending my time and how much time I'm spending on those various activities, so that when I do those checkpoints a couple of times a year, I have a sense of, I've been spending way too much time on this thing that I no longer find fulfilling, and then that becomes a candidate to move off of my plate. The other thing that I really highly prioritize is sleep. I've learned over the years that I do not function well if I don't have 7.5 or 8 hours of sleep. So I go to bed very early compared to some people, but it helps me function, and I think it really in some of the leadership roles that I've had at my institution, I found that when I'm not sleeping well, I can clearly see the impact that that has on everyone else on my team. And so as somebody who is in a leadership role, I really feel it's important to model good behavior, and I feel it's important to make sure that I'm functioning at my best, because if I don't, that has impacts on everybody else. And I found that sleep is one of those things that just is really critically important for me to maintain a positive attitude when I come into work every day.
Yeah, no, those are great ideas. Eating your frog. There's a book on that by Brian Tracy. Phenomenal read. You get the thing you've been trying to put off for a while. Do it in the high energy part of your day. It's a great start to your day. And there's also another quote saying, only things that are scheduled are the things that get done. The novice focuses on the small things, and the master focuses on the big things, right? So you want to put the maximum energy into your big ticket items. There's a little brain hack that I've kind of been practicing to get over procrastination lately. And so let's say there's a difficult thing you're trying to do, and you're not really getting it done, and you're putting it off day to day, saying, I'm going to do it next week. Just open it up on your computer and tell yourself you're not going to do it. You're just opening it up, no big deal. And then once you have lined up things like as if you were going to do it, say that, you're not going to do it fully. You're just going to do a little bit, and then do maybe the first 1 or 2 steps. And then you'll find that it wasn't that hard. And then you'd be like, why was I putting this off? Like, it's so easy. And then once you're 2 or 3 steps into it, it's actually easier to do it than to actually close everything down and try to do it another time. So I've been working on this trick on myself, saying, I'm not going to do it. I'm just opening it up. I'm just taking a look. And it actually works. And it's funny, but you can actually get it done. But yes, calendar is so working off a calendar and having a system, so that when you sleep at night, knowing that you have a process in place, that it's out of your head, your mind is empty, and you have a process and a system established that nothing's going to fall through the cracks. And then basically you live your day the night before, you plan your day, and then you go through a very busy day. But if you have a good plan before you actually get through the day, it's really powerful. There's a name for this, like don't start your day until your day's done, meaning you basically live your day the next day in your head the day before. And then as you practice this and become a master like yourself, don't start your week until your week is done, and then hopefully don't start your month until your month is done, and so forth. So really powerful ideas. And yes, they require practice. So, if anybody who's listening is finding that these ideas are new to them, I think just practicing these once or twice isn't going to cut it. The science actually says that to make new habits, you actually have to practice a new thing for 66 days in a row. Now, the 67th day, it's actually hard not to do it. And the example that's commonly quoted is like, we don't have trouble brushing our teeth in the morning. And if we tried to not do it first thing in the morning, that'd be really hard, because it is a habit that's ingrained. And as human beings, we're like a collection of habits. So if we develop these habits like working off calendar and scheduling your workout, and if you have a Thursday 4 p.m. workout, that's kind of your routine. Then if you miss it a certain day, then it feels really odd, and it's easier to do the workout than it is to not do it. And those are the things that really help, I think, in the wellness space.
So we've talked a lot about what we can do as individuals to promote our own wellness, to combat burnout. I would like to spend some time talking about leadership and I think what is really a critically important role of our leaders or ourselves as leaders in promoting wellness in our own organizations. We're recording this during the COVID epidemic. I think most people will be watching it during the COVID epidemic. We're at institutions where we've had a different degree of involvement in this epidemic so far. You are in Seattle, so you were really in the first wave of this in the US. I'm in Minnesota, where we're expecting our peak to happen about the time when this episode airs. So I think that this epidemic has really highlighted some things that were probably already existing in healthcare with respect to burnout, but we're really seeing a lot of those things being magnified right now. And I think that leadership is really playing an important role in how well not only organizations are coping with this crisis, but how individuals in those organizations are coping. So I'd like to turn and talk a little bit about that. And some of the challenges that we're seeing and some of the things that people are doing really well to cope with this.
Yeah, so, these are interesting times. And I think this COVID scenario is really driving a wedge between the good leaders and the bad leaders, such as making this divide really obvious. I think there's a couple of common threads that good leaders are doing. For example, in these difficult times, there is no such thing as over-communication. People are hungry for information. People want to know what's coming, what's in store. So I think having a line of communication, different lines of communication, email communication, having person-to-person communication, if at all possible. I know we're all doing Zoom for now. Some Zoom meetings are happening at UW. There's emails coming. There's emails that focus on wellness. There are emails that focus on policies and procedures. There are emails that are showing the COVID data. And then there's the stressful emails that show the financial situation. So I think good leaders need to communicate well, and they need to bring forward an authentic style of communication by being honest, so that people find them trustworthy. I think we need to share the information with the people on the ground because they need to understand the why behind what is happening around them. I think there's a lot of stress, and I think understanding the why, the reasoning behind the changes that are happening is really good for motivation. I think, we've had some staff furloughs. There have been pay cuts. I know that the pay cut that was announced at Mayo was in the news. I think leaders have an opportunity to lead from the front. I think if it starts with what happened when the Mayo leadership and the leadership at UW said that, the people at the very top are going to take the biggest pay cuts and lead by example. And then their core team is on the second tier, and then the local leaders in the department are tier 3, and then it trickles down from there. I think everybody is expecting that we are going to be working harder. Some of the changes that are going to be put in place is to mitigate the fiscal challenges, and I think that is where I have some concerns about where this might end up. I personally think of the COVID situation as a temporary problem. It may be a long temporary problem, but I don't see this as a permanent situation. And so the measures that we're putting in, I think with the transparency, I think we want to put in measures to mitigate this that are also temporary, that have sort of an endpoint, that I think people anticipate to work harder and longer. Don't feel squeezed longer than they need to be. This is the time to be kind. This is the time to take people along with you. This is the time to, take time to explain the reason. You can't really over communicate at this point. And I think the leaders that do this, who come across with kindness, with their charisma, with leading from the front, and just showing this more humane aspect of their leadership, I think is key in these times. What has your experience been in Mayo and talking to other people across the country with your ACR responsibilities?
I would say that some of the key factors that you mentioned are things that I have heard as well. Honesty, compassion, I think really transparency. Transparency, I think, also helps to build trust. You mentioned sharing data about rates of infection and things like that. I think being really transparent about, not just what are the numbers we're looking at, but what are the triggers? What are the triggers to ramp down in our non-urgent care? What are the triggers to ramp it back up? What are we monitoring to determine how we're going to calibrate that as we go out through the rest of this year and perhaps into next? What are the factors that leaders are using to make decisions? What are the factors that they're going to be considering when they roll back things? As you said, this isn't going to be permanent. It may last a long time, but the changes that we've implemented to deal with it, what are going to be the triggers to reverse those changes and go back to what we would have considered a normal operating mode in the past? I think being transparent about that is really critically important to bring people along with you. Being thoughtful and compassionate, I think consistent and fair when you're dealing with employees, not fair to treat one division one way and another division a different way, or, I think this certainly extends to our technologist partners. Are they being treated as fairly as the radiology staff is being treated? Being consistent and fair, I think, is really important for leaders to have folks behind them when you're in a crisis situation like this, and even in regular day-to-day activities. I think that the crisis highlights the good leaders and maybe also highlights those leaders that aren't so good. It magnifies that in a way that you might not see as clearly day-to-day, but many of the same principles apply whether we're in a situation like this or just talking about daily activities.
Yeah, these are clearly stressful times. All of us will be expected to work harder, work longer, but I think at some point we will pay a price on our wellness, because the state of affairs on how we're going to dig ourselves out of the financial crisis that we're in will eventually start to take its human toll on everyone who is involved. So I'm hoping and praying that we recover from this faster than we would anticipate. We'll have a vaccine and all of this will be good. And the next time we have a pandemic, we'll be well on top of things. But I think right now is more so than ever that I think we need to put wellness in the midst of it all. Is there anything that we can do slightly different that wouldn't impact the wellness of people is something that we have to think about. And then as soon as the finances start to improve, we need to have a wellness budget in our departments, because as everything costs money. And if there is this, big talk about wellness and it's not really supported with a budget behind it, it's only talk. And I think we need to see action on the ground. I think the baseline burnout levels that we were seeing in radiology pre-COVID were alarming, to say the least. Intuitively, this is only going to get worse with the COVID situation. So we need to have a wellness plan at the end of this. We don't really need to go longer with the change of how we reconfigure work, just based on the financial aspects of stuff. I think we as healthcare workers, radiologists, technologists, anybody who's connected with healthcare, we have a life to live as well. Our life has been disrupted pretty significantly, and we would like to go back to life as we know it. And I think everybody's looking forward to that. So I think making the decisions, trying to keep them temporary as much as we can, and then reverting those quickly that do impact staff wellness will be critical.
So one thing that we're doing at my institution that I think is a really cool idea, you know, as radiologists, I'm a neuroradiologist, and I will say in the early phases of this, I felt like, you know, I'm not a frontline worker. I really am not having a very big impact in this particular crisis. And I think many radiologists feel that way. You know, we're certainly not at the front lines in the way that our ED colleagues are, or critical care. I think in some ways that almost, some of us may have a certain kind of guilt that we're not contributing more. So one thing that my institution has done is it has created a network of essentially peer support, and trained individuals, and particularly individuals who may have a little bit more time on their hands, because some patients are not coming to see us for fear of contracting the virus, and we're not at the front line. So they've trained individuals to be peer support. And so those who are at the front line have a peer that they can call at any time of the day or night, and just talk, and have that social connection, have that human connection, have somebody that can listen to them in a you know, non-judgmental way. So that they can really work through what some people are describing as a PTSD-like phenomenon from being at the front lines and dealing with this crisis. They have people that are there to support them, and it gives folks who might not otherwise feel like they're contributing at the front line play a bigger role. And so I think that's been a win-win for a lot of folks.
Yeah, we're also doing a similar thing. We have a peer-to-peer support program, and our wellness activities through Zoom mostly have increased quite a bit. We're having a leadership town hall through Zoom every Friday, where, you know, the hospital leadership gets together with one of the WISE teams, and they discuss, you know, the events of the week, and try to put a more humane spin on things, on what we can expect, what did we learn, how are we going to how will we be navigating future challenges, and also take a lot of questions that people might have.
So I think in a lot of things there's a silver lining, and I'm hoping that a lot of these positive things that we're putting in place to deal with what is a crisis will be able to continue them and continue to promote wellness through them into the future. In the last few minutes, I would like to spend some time talking about what organizations can do to promote wellness. I'm active in the American College of Radiology. I mentioned at the beginning that my institution has developed something called the Wellbeing Index, which is a tool to measure burnout. It's a tool that can be used to measure burnout prior to an intervention, and then after, to really look at effectiveness of things that people are putting in place. The ACR is using this tool to help understand how this is impacting radiologists and what interventions might be effective going forward. So I think certainly at the organizational level, with either the institutions where we work or with some of the medical societies that we belong to, there is a really impactful role that those organizations can play. And when I think about SIM, I know that one of the statistics that I've seen quite frequently is the impact that things like electronic health records and PACS systems have had on burnout. And it's often cited as, maybe top 3, top 4 of impacts on folks. Certainly these tools can make us more efficient and more productive in many ways, but they're not a joy to use. And, SIM is an organization where we bring together folks who are radiologists, who are practicing, who are end users of these tools, IT professionals, PACS administrators, as well as individuals from industry. So I really think it's a fantastic forum where we can start to discuss how can we make tools that are a little bit more intuitive, that are easier to use, that, maybe someday are a joy to use, where we really see a positive impact on our patient care, and where it doesn't feel like a burden to us. I'm wondering if you have thoughts about what roles the various organizations and specialty societies we belong to, what might they do to help in this situation?
I think, at the University of Washington, we realized, maybe about 2 years ago or so that a lot of the informatics solutions we were offering outside of radiology, mainly to the providers out in the community, out running different clinics, were really independent systems that were really not talking very well to each other. And so there was a hodgepodge of network of these IT solutions, and to do a single task, sometimes we had to go through 3 systems, and there were enough surveys and data to show that, this really is a big cause of burnout. So we were actually having a massive investment in our IT solutions at the moment. We're going to come on a single platform and hopefully decrease burnout. But I think SIM has a great role to play here because it's a unique organization where the informatics people interact with the radiologist, so the end user, and try to get some of these tools that can hopefully automate some of the stuff that we find boring, mundane, and frankly better left to an algorithm or a software, and focus most of our energy on the diagnostic dilemmas in which a human brain far exceeds any computer capacity there will ever be. So I think SIM, and again, developing platforms and systems that hopefully one day can be standardized all across radiology. Like it's really interesting to see once you travel to different departments that we're all doing radiology, and yet we all practice in different ways. Most of us are not on the same systems. We have different flavors of PACSs. We have different RIS. Dictation systems vary. Policies and procedures vary. We do have guidelines for many things now. We're starting to get into standardized terminology and standardized dictation, but we're a long way away from practicing radiology in a standardized fashion by any means. And I think getting the informatics part of it sorted out is really key. The thing that I can control is the technology that I can incorporate in my daily life, right? So my computer has several different software versions of different programs that are running. And I have very low threshold for buying stuff that would save me time because it's repetitive work that we're doing. A lot of it is actually applicable to radiology. For example, I use voice dictation for email. I have text expander software, which is like macros that we have in our voice dictation. And many other, I like the calendar that I use has an AI interface, so I can free text type. For example, meet Amy at 3 p.m. through Zoom. It'll automatically put it on the calendar for me. And there's these, little things that save me a few minutes here and there. But if it saves me 3 minutes, 10 times a day, that's 30 minutes in the day. And I don't mind spending a little bit of money on that on that, software solutions. I think we should have a similar mentality as institutions also, that the most expensive resource that an institution has is the people. Their time is worth so much more than a software that we're going to buy that's going to make their job easier. If I have the tools and systems that can make me do my work in half the time, I'm going to be more productive. And if I'm more productive over time, the cost savings will pay for the investment that made my life easier. So in some ways, all of this is interconnected. This investment, which we may see as wellness or a tool that somebody is requesting to make their job easier, will actually help the bottom line. And I think for us at the ground level, and maybe as mid-level leaders, I think when we pitch these tools to our hospital leadership, if we can make a business case to them, then we can find a lot of support to get these systems, as long as they can see that if they spend several $100,000 on this system, this is what is going to change in their balance sheets in 2 years down the road. So I think it's a delicate balance. I think that argument is easily made in our heads, but a little bit more challenging to get it down on paper in a business sense. But I think there's I think a lot of radiologists are now taking a lot of more interest in business and finance. That I think going forward, I think we're going to advocate for ourselves more strongly than maybe what we did about 10 years ago.
I think we're nearly out of time. So do you have a couple of final words you want to say to wrap up?
Yeah, I think I want to, I don't want to sound as preaching in a way. And I think, like we were talking about this morning in our phone call when we were planning this session, these things are sort of running on a treadmill where you're running really fast and you're getting tired, but in reality you're stationary for somebody looking at the outside, but you're doing a good job. But if you were to stop running, you'd fall off the treadmill. And life seems fast. Many times, I think our work days clearly are really fast. And I think establishing systems that we can use to reap rewards on time saving are totally worth investing in, developing helpful habits that we can hopefully have better lives, and stop thinking about this notion of work-life balance. There is no work-life balance. There's only life. And work is a part of it, and try to live life to the fullest. Focus our work on joy, and hopefully at the end of our careers end in a point where we aspire to be and have a fulfilling career is the best that we can actually hope for. And learning from people around us. There's a lot of people around us. For example, I clearly have a lot of learning about fitness and sleep to learn from you. I'm constantly guilty of cutting down on sleep and sleeping less to meet a deadline. And then later on, I'll have a day where I completely, pass out because I have to catch up on the sleep. And so, there's things like this, it's not easy, but it takes practice and learn from people around us and just keep going, stay strong.
I have a quote that I like to live by. It's how you live your days is how you live your life. And I think about that often, and I try to make sure that every day I'm doing something that I really find joy in. And I think that if you do that, then you will have had a joyful life. And so I've made that a practice, and I'm really grateful that I get to have that joy just about every day. Thank you all for joining us today on the didactic portion of our session. We're looking forward to chatting with you more during the question and answer session.